Thank you, Dr. Monk, for sharing all of that data. It really is quite fascinating, and combined with the real life experiences that were shared in the film, it's very powerful. So now, in addition to Dr. Monk, I'd like to introduce you to Catrice Kane, who is the interim executive director of First Year Cleveland, one of the two organizations that developed this film. Welcome, Catrice.
Thank you.
Hopefully our discussion today will help all of you as you continue to process what you saw in the film. And we hope to leave you with some action steps that you can take back to your organizations. So let's jump into this conversation. Catrice, I'd like to start with you, just so you could share a little bit more with us on the background of the film and why it was developed.
Absolutely. Good afternoon, everyone, or good morning, depending on where you are. Thank you, Priya. Thank you, Dr. Monk, for that wonderful presentation. So for over 50 years, Cuyahoga County and the city of Cleveland, where this film was created, has had one of the highest infant mortality rates in the United States. And we know that our Black babies are dying at alarming rates in comparison to any other racial ethnic group. So after speaking with community members, healthcare providers, city and county leadership, and other key stakeholders, it was apparent to us that our community didn't fully understand the depth of the issue and its underlying contributing factors, particularly as it relates to the racial inequities. Many people thought that this issue was solely about poverty or something the mother did or neglected to do before or during her pregnancy. As Dr. Monk mentioned in her presentation, we found that women, Black women, were essentially being shamed and blamed for the loss of their babies. So within our local communities, we also spoke to Black women who shared experiences of feeling disrespected, disregarded, and dismissed when seeking clinical care, but also at work, at school, going shopping, or simply just walking in the neighborhood. When presenting this information to clinicians and community stakeholders, we found that it was difficult for some people to fully understand the intersection of racism and toxic stress on Black maternal and infant health outcomes, or they just didn't want to believe that these experiences of racism, of discrimination, of bias, of microaggressions, which I state are really aggressions, there's nothing really micro about them. They really didn't want to believe that these experiences that the women shared with us were actually happening in their communities, that they were actually happening in their healthcare systems and their departments. Many of our community partners felt like we're doing absolutely everything that we can. We're providing exceptional care. From what we're hearing on patient experience informs that the quality of care is good, but our women were definitely feeling otherwise. So many of our clinicians, community partners, expected and new parents that we spoke to, they knew the definition of racism, bias, and microaggressions, but they really struggled to understand how they operate in our communities, in our institutions, across systems, and at the policy level. So the First Year Cleveland Pregnancy and Infant Loss Committee and the Healthy Neighborhoods Committee of Healthy Cleveland decided to create Toxic: A Black Woman's Story. We really want to show our community that for Black women, where you live, how much money you make, and access to opportunities and resources, that they don't always protect these women from experiencing the unimaginable loss of a baby. We wanted our communities to see how individual, institutional, and systemic racism permeates every aspect of a Black woman's life, which leads to toxic stress leading to poor health outcomes. So this film is an educational tool that really shows one day in the life of a Black woman, what it looks like, just one day. It's a small snapshot of a lifetime of experiences that are passed down across generations. So we intentionally worked with a Black director and incorporated input from Black women into developing the script. We intentionally created Nina's character as a Black woman who seemed to have all of the protective factors through her level of education, employment, environment, a supportive and loving husband. And we engaged all local actors and actresses and also included women who have experienced loss as extras in the film. And if you watch the film again, in the corner store scene, you will see a woman wearing a t-shirt that actually honors her babies. It's important to note that while Nina is a fictional character, her experiences in the film are shaped by experiences of numerous Black women across the city of Cleveland, in Cuyahoga County, and I'm sure across the entire country. The film is just beyond maternal infant health. It discusses topics such as hair discrimination, workplace bias, patient-provider interactions, food insecurities, microaggressions, police-involved shootings, and so much more. And from what I hear and what I've experienced myself, after you watch the film a few times, you start to pick up on these other topic areas and begin to really notice how the film is just beyond that of just Nina and her situation as a pregnant woman and her baby. The film is designed to create meaningful discussions that can lead to equitable and sustainable changes, with the focus that we can ensure all of our Black mamas and our babies survive and thrive. So I really hope that you all enjoyed the film.
Thank you, Catrice. And I just personally want to thank you for your work and participation in making this film and bringing it to life. We have now been sharing it with different hospital and health system audiences through the American Hospital Association for a few months. And it has had a powerful impact on every group that we have shared it with, whether they are healthcare leaders in urban communities or rural communities. It doesn't really matter that they aren't from Cleveland, Ohio. This film really resonates across the country. Dr. Monk, the film is relatively new to you, and I think last week was the first time you were able to watch it. What is your response to the film, and how does it align with the research that you just presented and the need to address physical and psychological stress?
So I also want to thank Catrice and her team for just an incredible film. And so I've now seen it twice, and I'm sure that I will be watching it more and sharing it with others, and have to work out with you how we do that. You know, I keep on coming up with the word powerful because it really is a powerful film. And as you say, it touches on so many issues. I find the healthcare provider chilling, and yet I know that it's not unusual. And what I think one aspect of the film, of the many that is so important and frankly so well done from a how do you make a film standpoint, is that you really step into her shoes in terms of what goes on cumulatively throughout the day. And it's, you know, what is it like to be just experiencing so many, as you say, they're not really very micro, they're quite out there aggressions and disrespect, just all the different interactions. So I think that's so well depicted and can help people, as you say, it's an educational film, help people get into somebody else's shoes. And that is probably something we need so much of in order to make change, is really trying to understand someone else's experience in a very genuine way. I guess I'll also add that I also see patients as a mental health provider, and had a Black woman who lost her baby 2 years ago. And sadly, this is obviously not so unusual, but what you depict in the film is so consistent with things that she described to me about her daily life. And so again, really applaud you in the film. I hope that the research, and I hope this came through, that at least to my ear, the research in this and making one woman's story a composite of the thousands out there, thousands and thousands, they really are two sides of the same issue. And I hope working together, we need, I think, very much this kind of film to make it somewhat accessible, and so people can hear the story and again get into someone's shoes and what their experience is. I hope that the data can also help in making change by really both giving some of the numbers and then explaining the biology, making the links of how does stress really have these pernicious effects on people's mental and physical health, and then birth outcomes. I think the more we can characterize that, it adds to the compelling, frankly, argument to make change.
Great, thank you, Dr. Monk. And obviously, we showed the film so that everyone in the audience would have the opportunity to take in this real life experience. But there's also more that needs to be done than just watching a film. So I'd like to spend some time now talking about how do we take this film to action? And Catrice, maybe I can start with you. How do you envision the use of this film? Who would use it? And then what would they do after they watch it?
Sure. So first you have to keep in mind that infant mortality is a community issue. It's a reflection of the communities that we're living in. So we know that within our communities that Black babies are dying at higher rates than any other race or ethnicity. Then what does that say about our community? And I say that because oftentimes people feel that this is on the shoulders of the healthcare systems, or that city and county leadership needs to do something, or it's a state level issue. No, it's our issue. We need to take ownership of this. These are our babies that we need to protect to make sure that they survive and thrive. So I just want to start it there as you reflect on what you saw in the film and as you begin to think about next steps. So it's open. I mentioned that also because it's open to everyone. Currently, this film is being used by hospitals, healthcare systems, educational institutions, medical schools, nonprofits, for-profits, community groups, law firms, and just a whole list of other organizations across the country that said, we want to use this just to initiate conversation, just to begin the discussion of bringing unity around an issue and figure out what we can do. So they've also found ways that it's helpful in starting very difficult conversations when we think about racism. I think that people tend to feel more comfortable around diversity and inclusion and equity. When we get to racism, it's very hard conversations, very challenging conversations. But the tool has been a great visual to begin the discussion in a way to create safe spaces. So the first thing I recommend is after watching the film, take the time to process your thoughts and emotion. I thank Priya for setting that stage of the film, because it's so important to sit with your feelings. What are you thinking? What are you feeling? What resonated with, what angered you? What saddened you? And then really explore, why did that happen? Is it something you personally experienced? Is the fact that you know that this is happening to women every single day? Is it the fact that you witnessed maybe a situation in the office, the workplace scene, and you've experienced that yourself? Or maybe you made a comment such as that and didn't recognize that it was an aggressive statement. So I think these conversations are important to really acknowledge what are your emotional reactions and what stems from that. And then connect to see, have you been in similar situations, whether it's a loss of an infant or in a situation with a colleague that you made a comment or they made a comment, or you're dealing with something with your child, this issue of hair discrimination, or in fact, you've done everything that you can to make sure that you have the resources, the opportunities, and yet you see the challenges that persist every single day. For women, in particular for Black women. So processing those feelings, and whether you're aware of them or not, please know that these experiences that you see within this film occur every single day in the lives of Black women, every single day. And they just don't affect Black women, they affect us all. Because when you see the situation between two colleagues, then that affects the culture of the environment, of the institution. When we see certain policies that are being implemented towards others and not for other people, then we see how the structure around our policies and our procedures are impacting how they shape the work that's being done in our communities as well. Then I encourage you to begin to think about next steps. It may involve encouraging your organization to purchase the film at toxicshortfilm.com, or it may involve working with the organization to examine the work you're doing to improve Black maternal and infant health outcomes or to address racism through patient care policies and procedures. Think about what's your approach to achieving equitable maternal and infant health outcomes. Is it centered on the lived experiences of Black women? Does it amplify the voices of Black women? Are you approaching the work through an equity and anti-racist lens? And these are just a few questions, but they're a starting point to examine how you and your organization can use the film to support or refine your current efforts. And please know also that this film is not the end all be all. It's a tool to lead meaningful discussions that can lead to action. But I do encourage that you figure out a plan really take the time of what you can do to surround the film with additional training and conversations so that it's aligned and coordinated with the mission and value of your organization and the work that you're trying to do.
Thanks, Catrice. And one of the conversations that has stuck with me since we first watched the film was one that we had with Summa Health System. And we were talking to them about how they were using their film with both their residents and all of the attending physicians that work with those residents. And they mentioned that it became a very powerful tool to drive conversations about what was really happening in care delivery within the hospital and health system. And it made it a safer space for residents and fellows to raise issues because they could refer back to the film rather than having to call out and attending another physician or someone that may be superior to them within the organization. And I think that's how you start to change culture, right, with this film, right? You use it as a powerful way to change the narrative that is taking place within a hospital or health system. But we're obviously sharing it with hospitals because we're the American Hospital Association. But I think the point that you made about how it isn't just on hospitals or the state or the county or other groups, it really is something that we all need to take on is a really important point that I hope everyone will leave this discussion with. And Dr. Monk, in your talk, you pulled out specific data points and you started to make the case for how we change the way we deliver prenatal care. Can you tell us a little bit more about that and how it can be connected to the film?
Yes, absolutely. And, I do think that starting with our individual feelings, that touching base with ourselves is such an important starting point. And I'm forgot that my first reaction to the film that I now want to share was wrenching. And really being able to acknowledge that is, because I think powerful comes after wrenching. Wrenching is really the emotions and powerful is more of a cerebral, oh, well, this can have a big impact. This is a really important film, but it is wrenching to watch. And that needs to be, it needs to be that way. But part of changing the culture is making space and time for whatever provider, whether you're a physician assistant, an obstetrician, a nurse, a mental health provider, community health worker, and you're in this ecosystem to make change, I think we do have to start with being able to be in touch with our own feelings, because we're not going to be able to identify with someone else's experiences and really be attuned to them if we can't be in touch with our own feelings. So on a very small level, and I will answer your question with broader brushstrokes, but what we've done on our mental health care service, which has diversity in providers, not as much as I wish it did, but led by a Black woman on our service who said, we really, starting with George Floyd's murder, we have to make space for us as providers to talk about race and ethnicity with ourselves and also in our interactions with our patients and what's going on in their lives. So we really have dedicated time for that. I mean, of course, we have other case conferences, but this is really about, and it's really become a focus on race. Sometimes it's also ethnicity. So that's a small example, but I think it's changed certainly had an impact on me clinically and how I think about things, and it's an ongoing way. The rest of our department is talking about how can they do more of that. It's one thing to sit in the class and learn something about how I need to listen better. It's another thing to interact with your colleagues and hear their responses to what you say, to contemplate what it's like for your patient who's a Black woman, and share those feelings. So I think we really need more of that. It's hard to find in these busy healthcare systems, but we need more of that. I would say we really need more probably group prenatal care. This has been shown to improve outcomes. It enhances trust. A little bit like what you were just describing, when there are others in the room to refer to what you're experiencing, the trust comes from more courage to say things. Frankly, providers really like it. It can offer social support. I think it can bring some community to the prenatal care experience, in addition to what hopefully they're having in other parts of their lives. If there's the education that needs to happen for obstetric providers really needs to include knowing the legacy of the father of obstetrics, who, as I'm sure many of you know, did some of the first procedures on non-anesthetized slaves, female slaves, and that is the history, needs to be part of anybody's training who's offering obstetrics care. And it's not just I saying this. Many people think that needs to be part of the education. There needs to be really some built in part of the training that people have to become providers, to be able to have self-reflection and think about power dynamics. I keep on thinking about, again, the chilling provider. And providers are terribly, terribly busy. But in my view, she had lost her ability to see that she had a human being in front of her, and that can't happen. So what do we, how do we help the resident speak up who sees that? How do we help the patient speak up? But how do we also help the provider never get to that point? So that there is, this education around these issues, aspects that are getting developed around an anti-racist culture. And there is this kind of needing to engage with themselves and their own feelings with their colleagues about issues of race in order to really, again, make change. And I just want to say one other thing, if I can, that Catrice, I so agree with you about community. And then from a systems perspective, I mean, the community responsibility is so important, and ownership too, right? Because there comes agency if there's ownership. But also from a meta perspective, I hope there can be political change, because the communities don't have equal access to resources, on and on and on. That's gone for so long. So again, for me, that is the social determinants of health, the allostatic load, the wear and the tear on the body, that then of course gets down to individuals and affects health outcomes.
Absolutely. And I was reading through the comments as the film was playing, and someone commented in the chat for this conference that weathering is real. And I think that is so accurate, and it is 100% real. And I think this film does a nice job of showing all the angles from which those stressors and attacks come. So I'm going to go a little bit off script. When we have shared this film, and I believe yesterday, a Latina woman shared her experience, and we're hearing stories from all different populations, not just the Black community. And it reminds me of a quote I read in a book, which is that if something is bad for women, it's worse for women of color, and the worst for Black women. And I think we are seeing that when we look at maternal health and infant health, that outcomes support the fact that it is the worst for Black women. But we know it isn't good for other women of color and white women as well. And Dr. Monk first, I'll go to you, and then Catrice, would love your thoughts. Like, how is this impacting other communities, and what should we be aware of from either a data perspective or just as we start to work on this more broadly?
Oh, wow, that's such a really good question. I mean, it's such an important one and close to my heart, because, for example, around trying to get time off from work, pregnant people still have tremendous difficulties. It's a terrible stressor, and that is independent of race or ethnicity. And so that kind of bias that happens, the kind of sexism that still happens at work, often in workplaces, or the difficulty with a partner, and potentially this is possibly more common, I actually don't know the data, in heterosexual couples, but of finding equal household duties happening, and the kind of added stressors that fall on the person who is in the more maternal role, the female role, taking on, not only working the same amount as, let's say, the husband, but also doing more at home. I mean, I think if what you're asking is, do we also have gender issues going on? The answer is absolutely. And it astounds me, the kind of sexism and paternalism that can happen still in the workplace, in the interactions with a doctor who, let's say, tends to be male and of a very different generation.
Patrice, did you have thoughts to add there?
Sure, I can add to that. I agree with Dr. Monk. We're seeing the same, similar issues just around access and resources and the support that's needed in situations on the job and day-to-day stressors. I mean, that's the experiences of women in our local communities, and I'm sure across the country. So when we talk about Black infant mortality, we know, or improving Black maternal health, that if we can improve Black maternal health, it does help women of all races and ethnicities. That's why I say it's a community issue, that all women can benefit from it if we have targeted solutions and strategies to address this issue. But definitely, our focus is making sure that every woman, whether she's thinking about getting pregnant, whether she is pregnant, that she's been touched. She has the access that she needs. She's on the path to what resources and opportunities and support is needed for her. And that's the most important thing. And yes, we are going to be focused because we know that the Black infant mortality rates are higher, particularly in our communities. But at the end of the day, we want to make sure that our women feel supported and connected, that no one falls through the cracks. And there's so many stories. We actually did a study with Black women, Latinas, and white women. And while there were vastly different experiences between Black women and Latinas within healthcare systems, we did hear stories from white women and their experiences and things that they say. And we have to honor that. We have to take that seriously. We need to make sure that we are improving clinical care for all women. That is the case, absolutely. When we spoke to Latina women, it was the language barriers. It was not being able to have their mother in the room with them to interpret, and having a clinician say to her, this is an English speaking only hospital. So there's so many issues, beyond just Black maternal health and infant health that we need to address, that we need to talk about. Absolutely. There's a lot of things taking place that we need to be more responsive to across all communities.
Thank you. And I say yes to everything that both of you just said. And, we have time for one more question. So a lot of the actions and the things that we've talked about today have been focused on, addressing those social needs for individual patients and providing them the support that they need, or perhaps addressing the needs more broadly as social determinants within a community. But sort of the elephant in the room is the structural racism that we saw in the film. And how do we really make change on that fundamental systemic problem that we have across our country? Catrice, maybe I can start with you.
Sure. So my first thing is that we need to acknowledge that racism exists. That's the first step. You cannot fix something that you fail to acknowledge as being the issue in the first place. And I believe that within our country, this has been difficult for many people, organizations and systems, to openly admit that racism exists and has been existing for over 400 years in our country. Once we acknowledge that it exists, once we collectively acknowledge that it exists, then we'll have a better understanding of how it operates through personal encounters and institutions across systems and at the policy level. Then we can begin to examine these interactions, these policies, these procedures, these systems, to identify what changes need to happen to address racism. So I think those are core approaches to this work, especially if you're first starting to get your hands deep into it. And what I mean by addressing and examining is when supporting mothers, it includes assessing how concerns and complaints are addressed across systems. It's taking to look to see if equitable care, and I mean equitable care, not equal care, but equitable care, is that being provided to women? Are they getting what they need, when they need it, how they need it? And it just doesn't stop at patient care. It requires looking at the entire system. HR policies, the racial and ethnic makeup of the board of directors. Some people don't think about that, but you have to think about decision makers, how funds are allocated, how other decisions are made, who's benefiting the most, who's benefiting the least. When a patient complains, what's the process? When an employee complains, what's the process? A lot of the times we think through the lens of patient care, but many of the women that you're working with could be pregnant, could be thinking about getting pregnant or are dealing with racism. So we have to be just as sensitive to our patients. We have to be just as sensitive, to our colleagues and our staff as we are to our patients. They require the same respect and healthy working environment and safe spaces. So thinking about when an employee complains, what's the process? How is it handled? Are there sufficient staff that are representative and reflective of the communities that you serve? And making sure that all of this work is not on the shoulders of Black and Brown individuals. That you're not using tokenism as a way to do this work, but it's a collective effort at all levels. And most important is that there's strategy, there's resources, there's capacity, there's knowledgeable people at the table to move this work forward. Oftentimes when we think about diversity, equity, inclusion, anti-racism efforts, we give the least amount of funds to this work. It requires money. You need tools, you need resources, just like with any other initiative. So I encourage our organizations to be intentional, to really strategize and to really assess what will it require to do this work and to do it well that can lead to equitable and sustainable changes. And then remembering that we do have to work with a sense of urgency. It's not about checking boxes. That racism has been rooted in our country, as I mentioned before, for over 400 years. So we need structures in place. We have to realize that this isn't a quick fix. It will take some time. But if you're moving quickly, you're doing what you need to do, you're putting things in place, we can make the changes that we need to see to make sure that we are providing the right support for our mothers and our babies. I know we can do it, but we have to lean on each other and be very intentional of doing it.
Absolutely. And Dr. Monk, with a minute or so left, would you like to add some thoughts there?
Yeah, well, no, Catrice, I agree with everything you said. So just, really ditto. And I just to add a few different points or additional points is, I think we have to understand why this is so threatening to some people to actually have equality across races and ethnicities. And I think about the book by Heather McGhee, The Sum of Us, and how some of our economic challenges in this country in terms of how resources are distributed all around is part of what's behind that. But we've got to understand that why it's so threatening in order to make change throughout the country, which really needs to happen, because there's so much resistance in some groups to making this kind of change. I think we have to be really careful about what's happening in our daily lives, how we comport ourselves in our families, at our schools, at our whatever religious organization we're part of, in our work environment, and check in with ourselves about how we treat other people and what kind of unconscious bias we have in some of our interactions, and being really aware of that. And I think the more I'm in diverse environments, I am so much happier. I am learning, it is better. We all thrive. We get more done when we come together. So I think the missions to diversify environments, whether it's the corporate boardroom, it's the training program, we have to do that.
Yeah, thank you. And thanks for referencing that book, The Sum of Us. This isn't a zero-sum game, right? So as Catrice mentioned, and Dr. Monk also echoed in the research, when we improve outcomes for Black mothers and Black infants, we will improve outcomes for all mothers and all infants. And so we are out of time today, but if you are interested in finding out more about the toxic film or how you can purchase it for use in your organization, you can visit toxicshortfilm.com. Dr. Monk and Catrice, thank you so much for being here to share your insights and perspectives on this film. I really enjoyed our conversations, and thank you to all of you in the audience who watched this entire session on distress in pregnancy. I hope you enjoy the rest of the 2020 Mom Forum, and Joy, I will hand it back to you.
Thank you so much. What an engaging and important conversation and film and presentation. Dr. Monk, thank you all very much. You touched on several themes, but Priya, what you shared about the beautiful quote, we'll have to put it in chat or in the Whova app, about, this is an issue that impacts women, maternal health, all women, regardless of skin color, but impacts the BIPOC community even more and has the greatest impact on Black women is such an important view on the issue. And we really appreciate you saying that. I once heard about the curb cut theme where those in wheelchairs, right? Sidewalks were created for those in wheelchairs with that curb cut. And that benefits all of us. And I think that analogy is really telling and on point here. So thank you to the three of you again. I want to point out that tomorrow on the main stage, we'll get to unpack the policy considerations around disparities with Congresswoman Underwood. So that will be a session you won't want to miss. Before we move on to our breakout sessions, we are going to do our Poll Everywhere word cloud together on this morning's session. So if you could please go to on a web browser, pollev.com/2020mom and drop in the word or a phrase using an underscore in that phrase. But thank you so much. What an engaging and important conversation and film and presentation. Dr. Monk, thank you all very much. You touched on several themes, but Priya, what you shared about the beautiful quote, we'll have to put it in chat or in the Whova app about, this is an issue that impacts women, maternal health, all women, regardless of skin color, but impacts the BIPOC community even more and has the greatest impact on Black women is such an important view on the issue. And we really appreciate you saying that. I once heard about the curb cut theme where those in wheelchairs, right? Sidewalks were created for those in wheelchairs with that curb cut. And that benefits all of us. And I think that analogy is really telling and on point here. So thank you to the three of you again. I want to point out that tomorrow on the main stage, we'll get to unpack the policy considerations around disparities with Congresswoman Underwood. So that will be a session you won't want to miss. Before we move on to our breakout sessions, we are going to do our Poll Everywhere word cloud together on this morning's session. So if you could please go to on a web browser, pollev.com/2020mom and drop in the word or a phrase using an underscore in that phrase between words that most resonated with you for this morning's session. We'll take a couple minutes to do that, and then we'll pop up that word cloud. Here we go, and you can keep your words coming. Fired up, toxic stress, community, Black. And we know if this word cloud would allow us to capitalize that word Black, we would see that capitalized, powerful. It's great to see, gave me goosebumps. Community, allostatic load and allostasis, BIPOC inequities. What happens to one happens to all. I think I saw that really powerful. We'll keep these words coming. We are going to save the final word clouds to the Whova app for all of our breakout sessions, and I cannot wait to come back and see what jumps out most for this panel. Thank you again to our panel. We are going to be moving now into a very short break, and then we'll head into our breakout sessions today. Just pointing out some of the sessions that are going to be happening in breakouts that were hit on in this last session. We heard about Catherine Monk talking about group pregnancy care. A Centering Pregnancy model is a leading model around group pregnancy care. There's a breakout session on that today. We also will hear about the use of certified peer support specialists to build community and the use of that model for Black peers and doulas. There's also a session on the role of community-based health workers in maternal mental health, and many more breakout sessions, including one on race, how to address racism in clinical settings. That's being put on by AWHONN, the Association of Nurses that supports the perinatal period. So do check out breakouts. They start at 11:45. And that's just in a few minutes here. So go ahead and take a quick break and head into those breakouts, 11:45 Pacific time. We will return to the main stage at 12:05 for our panel discussion about hospitals and what hospitals can do to lean into maternal mental health, and also what that means from a quality perspective using data and quality management strategies. So we'll see you back on the main stage at 12:05. Enjoy your breakout sessions. Thank you.